COVID-19 caught the world by surprise. It was devastating and it claimed many lives. Many were left with emotional scars, some even not having a chance to bury their loved ones. COVID-19 also raised global awareness of mental health and the need for more accessible, effective solutions. And though global political support for mental health has grown over the past decade and is now being included in the United Nations Sustainable Development Goals and all 194 World Health Organization member states have signed the Comprehensive Mental Health Action Plan 2013 to 2030, Dr. Kagunze leads the Non-Communicable Disease, Injuries and Mental Health Unit, Disease Control and Prevention Division at the Africa CDC, which is headquartered in Ethiopia.
Thank you. Mental health has been overlooked for many years, but we all know that without mental health, there's no health. So we all know the definition of health by WHO, which is physical and mental health. So it needs to be both, not only physical. But for many years, mental health has been overlooked. But with COVID, and that's where your question is very important. With COVID, we've seen the importance of mental health. We've seen how outbreak cause a toll on our mental health with uncertainty, with lockdown, with disruption. And in 2022, this is where the Africa CDC have developed a continental plan to support mental health, promote mental health and well-being in member states.
One of the focus areas for the workshop is to integrate mental health strategies into the outbreak response framework with participation from emergency departments across the region. Dr. Kagunze is of the view that more needs to be done regarding mental health and to ready governments for any eventuality.
But other interventions include, for example, supporting countries to reform their mental health policies and laws. Because this is where it starts. Without policies and laws that are supporting mental health, that are giving protection to workers, we cannot move much. So this is what we are doing by supporting countries to review the outdated policies and develop new policies in line with international and continental standards.
He pointed out community support provided during outbreak responses as a critical intervention, saying that the initiative aims to align company policies with international and continental standards, creating a supportive environment for workers and communities affected by public health emergencies. Emil Seibeb, NBC News, Windhoek.